So we are starting in 1 minute. And I'm going to start recording. Dr. Yamashita, could you record the meeting in Portuguese, please?
Okay.
Eleonora, could you record your session in Italian, please? Mario, could you record the session in Spanish, please? Okay, here the second video. So hello again, Doctors Federation for the World, in short, DFW family. It is so nice to have you with us again and so satisfactory to join us as a big family that celebrates every 2 weeks with the single purpose of having healthier lives, families, and communities. During all the session, DFW tries to find alternatives for safe, affordable, and efficient therapies that target two health issues, but above all, to take preventive actions. My name is Raul Pineda, biochemist, DFW General Secretary, and today we have invited amazing friends and colleagues. Dr. Ricardo Yamashita, medical doctor and integrative doctor from Iguazu Falls, Brazil, and Patricia Calisperis, pediatric traumatology surgeon, researcher, and integrative practitioner from Bolivia. Welcome, Ricardo and Patricia.
Hello, Raul. Hello, everybody. My name is Dr. Ricardo Yamashita. I'm from Brazil. Today is another very special occasion for many reasons. The first one is for your interest. The second, for the opportunity to share this introductory message with a great colleague and friend, Patricia Calisperis. And finally, because today we celebrate our 101 DFW conference meeting. Welcome, Patricia.
Hello, Ricardo. I am Patricia Calisperis. I am pleased to introduce this session today. Let me welcome everyone to this fifth academic session of 2025 and the 101 first DWF Federation Conference Week. Today, April 27, 2025, we will have the opportunity to have a different but unique academic session that is sure to bring some fascinating, interesting, and innovative message to our audience. We are streaming live from the Zoom platform with a maximum capacity of 100 attendees. Let me emphasize for all those who connect later, you all can also reach us also our Facebook, Instagram, X, formerly Twitter, LinkedIn, and YouTube, Doctors for the World Federation. Please share this with colleagues and friends, families. You will find at the bottom of your screen a global interpretation logo where you can choose the interpretation according to the flag, language, or your choice. You're the Hindi language. The Zoom platform has not yet included the Indian flag, so we have had to choose the closest and biggest neighboring country, which is China. We apologize for this inconvenience. Ricardo, why don't introduce DFW to our first-time visitors, please?
Okay, Patricia. Doctors Federation for the World, an international organization that over the last 5 years has played a relentless, productive, and important role in 5 continents. The FW has built hope and broken paradigms. Patricia?
Founded in 2020 in Piedmont, Italy, by Dra. Fanny Casallo.
¿Podrían agradecer y dar de baja a Mel, por favor? Vivi, de baja a
Something is
Mel, por
going
favor.
wrong there.
Sí, mira. Ay, mira, espérame. Pero sabe la fregada aquí.
Vivi, ayúdame, por favor.
Mira.
Listo, ya la saqué.
Gracias.
Well, sorry for that. We continue. Founded in 2020 in Piedmont, Italy by Dra. Fanny Casallo, DFW is a non-profit organization which has been endorsed by numerous health specialists from all over the world. Our aim is to address acute and chronic disease from a pathophysiological point of view, with a long-term approach in which people from 5 countries participate on a voluntary basis. Our innovate, disruptive, and constructive strength has enabled real-time interdisciplinary communication and work from health specialists with a simultaneous translation into 4 languages: English, Spanish, Italian, and Portuguese. Once again, sorry for the what happened. Ricardo.
Yeah.
You are muted, Yamashita.
Dr. Ricardo, you are muted.
Dr. Abubkar is with us.
Great. Dr. Ricardo, you are muted. Está em silêncio, Ricardo. Agora sim.
Sorry. Our mission is focused on providing integrative health solutions for human well-being. Our mission is to lead the national organization in the search for safe, accessible, effective, and efficient treatments and preventive interventions, clinical practice guidelines, traditional integrative medicine, protection of vulnerable populations in crisis situations, and public policies. Our values seek plurality and open equality of ideas and humanity. Our objectives focus on generation of solutions of long-term value, as well as close collaboration between clinicians, researchers, and the general public. Finally, our activities have focused on both the communication of monthly preventive health schemes as well as interdisciplinary work with authorities and government.
Our physicians around the world, the globe, have been using evidence-based medicine, EBM, approaches to give feedback to their governments and societies regarding preventive and curative shames.
In this way, we have held lectures, the following profile of speakers: 59 with doctorate level, 42 master degree or specialty, 26 with bachelor's degree. With respect to our worldwide influence, DFW has held 60 from America, 37 from Europe, 11 from Asia, Africa, 16 from Asia, and 5 from Oceania.
DFW is a proactive organization that is recognized for its deep, proactive approach to community and long-term collaborative work with governments. It is respectful of local health decisions in each country. It does not seek information, the deterioration of any status quo, or the disruption of current health agendas.
We focus on doctors, nurses, and other health professionals alike.
In addition, we target governments, authorities, health systems, regulatory office, social media, intellectuals, philanthropists, and civil society.
Thanks to the above, in 2020, we integrate our progress in a successful and unprecedented international summit that took place virtually from November 11 to 15th, 2022. Thanks to your participation, we integrated the most transcendental academic program in the history of mankind. It was the largest, 127 speakers, ambitious, 73 countries, collaborative, 4 pillars, plural, 5 continents, measurable, 4 social networks, Zoom, Facebook, YouTube, LinkedIn, in multilinguals, 5 languages in simultaneous translation. Specialists from all over the world share their knowledge in various topics with the sole aim of improving the living conditions and health of the world's population.
Our management is based on 4 main access pillars: clinical practice guidelines, traditional and integrative medicine, impact on communities at risk, public policies and crisis situations.
Finally, DFW is concentrating on structure, consolidating its objectives, supporting and receiving support from clinicians, researchers, and academics, sharing our vision and values, as well as joining forces with like-minded medical associations. We invite you to be part of our family and help us with your donation to support our technological structure and translators.
At DFW, we are convinced that only by dreaming big, working tirelessly, staying focused, and working while surrounded by valuable people like ourselves, will we achieve and exceed our goals. Thank you, thank you, thank you.
DFW is a non-profit organization where everyone receives no payments at all. During 5 years, our structure has been supported from grants of its board of directors only. Today, we kindly ask you for your support, making sure that your microphones are switched off during all the session in order not to exceed 2 hours. There will be no live questions for our keynote speaker, but you can interact with him or her through the chat box in 5 different languages. To our speaker, We kindly remind you to keep track of your time with a maximum of total 45 minutes and following 30 minutes round of questions and answers. We also remind you to speak as slow as possible while allow our interpreters to translate properly.
Now, let me introduce to you to our Vice President, Dr. Susan Rush from India, who will give us a short message, and she will be our Master of Ceremonies today, as well as introducing our guest of honor. Welcome, Dr. Susan Rush.
Thank you. Thank you very much, Dr. Patricia. Thank you very much, Dr. Yamashita. And it is my pleasure and privilege to be here with the Doctors Federation for the World and welcome all of you who have joined us today. And the Doctors Federation for the World stands for the Integrative Cellular Detox. We integrate all the methods to ensure that the self-healing system is supported. And with that, it's my pleasure today to introduce our speaker. Just a moment. Our honorable speaker is Dr. Muhammad Abu Bakr. He is going to speak on immune-mediated musculoskeletal pain, a novel etiological framework. He is a specialist in traumatology and orthopedics with over 20 years of clinical and teaching experience. He is a fellow of the Royal College of Surgeons, MRCS, and a fellow of the College of Physicians and Surgeons of Pakistan, FCPS. He currently serves as an assistant professor and orthopedic consultant at leading medical institutions in Peshawar. He has worked in highly complex settings, both in conflict zones and in emergency response, and has been actively involved in medical training and clinical research, with multiple publications on musculoskeletal health. Recognized for his comprehensive and evidence-based approach, he is a speaker committed to continuous improvement in medical practice. Such a pleasure to have you here with us at Doctors Federation for the World, Dr. Muhammad Abu Bakr. The stage is yours. Thank you so much.
Thank you. Thank you. So nice of you. I'm obliged and I'm thankful to be invited in your session for presentation. Thank you. Thank you, madam.
Thank you. You're most welcome.
So we will start with the presentation.
Would you like to upload your slides, or you want me to do that, Doctor?
You can, if you can upload it, that will be very good. That will be easy.
Okay.
Is it possible for you to come on video, Dr. Abu Bakr?
Yes.
Thank you so much.
Can you all see that? The slides?
Yes, we can see the slides, but I cannot see
You
Dr.
can
Abu
see him.
Bakr's
Okay.
video till now.
Now,
Mhm. Yet.
it is on.
Okay, but Rahul, can you see? I cannot see him yet.
Dr.
No.
Abu Bakr, could
Yes.
you turn on your video, please?
Yes, this is on.
Yeah, something is going on with his video.
We,
It has
yeah,
happened
we
to me
cannot
before.
see.
Yeah, well,
Your camera.
yeah. Well, doctor, you can start anytime you would like, because yeah, your video isn't working properly.
Okay. So, Bismillahir Rahmanir Rahim. It is in the name of Allah, the most merciful and the graceful. It is about immune-mediated musculoskeletal pain and novel etiological framework. It is the need of the hour. It was designed for the needs of the local patient. Pain, it is a global problem, and multifocal treatment are being administered, and still it is being a problem, causing much more problems like opioids and crisis and things in developed countries. The data we have analyzed or the data which we are uh, based our presentation are from developed countries, US and UK, because this was available in the literature. Data from developing countries is not that much available, but this is more of a concern for developing countries as well. So it is basically pain management, malnutrition, stress and anxiety, and immune disease. Malnutrition due to processed food or inadequate dietary intake, causing to malnutrition or immune deficiencies, and stress, physiological stress, economical instability, or social factors can cause a repeatedly low-grade infection, and which can manifest as pain, musculoskeletal pain in any region, mostly in spine, lumbosacral area, or sacroiliac joint, or can come with the shoulder or any other joint. So the first thing is we have what we suggest, or the proposal we have to come is for the doctors and for the like-minded people to identify the challenge and assess the prevalence and impact of pain, stress and malnutrition, and immune diseases. It costs a lot of billion of dollar to the developed countries, and this is devastating for the developing countries because they are not up to the mark and they are being treated on the long lines for pain and exploiting their condition, which is a misery. Analyze connection, exploring relation between health issues and the common triggers, and develop strategies to create a multidisciplinary approach. Stress and anxiety alone is causing about 190 billion annually to United States. And there have been workplace stresses, workplace problem, environmental problems, social factors, and particularly concerning the working hours, jobs insecurity and things. It's about what is costing, just mental health is costing 190 billion rupees. And what we have observed in our study, we suggest a simple walk in nature, 50 minutes per day, can eliminate your daily stresses or wash off your daily load of cortisol. Just 50 minutes simple walk can wash off your load of cortisol and prevent any hypertension, hyperglycemia, or immune diseases. Processed food and malnutrition is another issue which is causing energy imbalance and excessive additives with inadequate nutrients, micro and macronutritional deficiencies. So this is on one side damaging health and microbiota, and on the other side, it is keeping you weak, a hidden hunger. There is insufficient uh, necessary, which is necessary, essential minerals and vitamins. So processed foods is the leading cause of malnutrition, and we have observed it in directly proportional in pain patients. That packaged food like chips and things, packed fries and things, they were associated with pain syndrome. Cold drinks in particular. But cold drink is one of the cause of pain. Now it is our practice. If a patient is complaining of pain and he is having cold drink in his routine, first he has to stop the cold drinks. And we have quite a lot of patients, in a few hundreds, who never need any other treatment. So just soda drinks, avoiding soda drinks.
Vamos acordar. Senão à noite você não vai dormir, filho.
Allergic conditions are
Frio,
very
né?
common. Immunological conditions, and immunological conditions are same as any allergic condition. Allergy is basically one of the immunological mismatch or immunological phenomena. So as immunological conditions, every immunological conditions, these pains, aches and pains, which have any seasonal predominance, is immunological in nature. It can be a type 1 hypersensitivity in case of severe anaphylaxis require emergency intervention, or mostly we deal with type 3 immunological reactions, which is complement mediated and which is reactive arthritis and rheumatoid arthritis, or non seronegative rheumatoid and things. Urinary tract infection, it's being the most common bacterial infection, particularly among women. 40 to 60% women experience UTI in their lifetime. And UTI, once diagnosed, it is a recurrent issue. It can be asymptomatic. It can be asymptomatic in 80% of the time. It activate immune response, which can potentiate immune-mediated arthritis or any non-neoplastic aseptic pain is particularly a reactive arthritis or a reactive pain due to distinct UTI. Reactive arthritis, as we all are aware, is particularly something with the HLA-B27 genes, and the recorded incidence so far for reactive arthritis is 1 in 40 per 100,000 annually, but it is increased. In our study, we have found that osteoarthritis, it is not disabling, it is not causing problem. The people only come to clinic with reactive inflammation of that arthritic joint. Stress, it can be acute, it can be chronic, it can be environmental stressor, psychological or social factor. 77% of Americans experience stress regularly. Hello? The core hypothesis that any non-neoplastic aseptic.
Your microphone went off, Dr. Abu Bakr.
Hello? Can you hear me?
Now we do. Thank you.
The core
Yes.
hypothesis. The core hypothesis is any non-neoplastic atraumatic, primarily aseptic pain, arthralgia or myalgia is a result of immune-mediated reaction or a type 3 immune reaction. These reactions are triggered by subclinical urinary tract infection, exposure to cold air, cold water, anything cold, cold temperature, working with freezers. There we have observed it, working on cold floors. Yes, they are associated with working outside with cold water. Yes, these are variables studied differently in hundreds and hundreds of patients. We have studied sour food. Sour food, we have studied different grapes, oranges, and peaches, vinegar, and we have found that in raw form, if they are consumed, they trigger immune reaction and causing pain. And when they are titrated, oranges and other fruits, when they are titrated with other fruits and used in the form of juice or fruit charts, they are very helpful. So titration for sour foods are advised, and these variables suggest that to induce an endocrine immune dysregulation, which ultimately leads to inflammation and pain. Exposure to cold, consumption of sour foods alter the physiological response, which can contribute to immune-mediated pain. Cold exposure is known to have induced a vasoconstriction, potentially reducing the mucosal immunity, while sour foods may shift the pH level, affecting the gut microbiota. So they need to be studied, but their relation with pain was observed directly and repeatedly. There are the results were reproduced hundreds and thousands of times, and they are being studied repeated time and time again. Studies focusing on temperature sensitive transient receptor potential channels and their role in pain pathway, critical for understanding of the impact of the environmental trigger.
Faccio solo che accenzo uno che sta morendo.
Conducting a comprehensive studies may enhance our understanding, but the take-home message is the impact of UTI on global health and its impact on the annual health budget and quality of life. Just a simple test of urine, your routine examination, can diagnose your urinary tract infection, which, if treated, will cause to subside your pain or relieve your stress and anxiety of disease of carrying a chronic pain, which can alter your blood pressure and sugar level. UTI affect about 400 million individuals annually, contributing to a rising healthcare cost. Women in particular had a 30-fold increased risk of developing UTI compared to men, those aged 20 to 40 due to anatomical and hormonal pathway. The elderly population, those who are 65 and with comorbidities, showed a higher incidence. There is also a regional variation in sub-Saharan Africa and Southern Asia, underreporting and exacerbating public health crises. Morbidity and mortality are linked to over 300,000 global deaths each year, with the alarming increase since 1990. The rise in secondary bloodstream infection in ICU patients emphasizes the urgent need for robust infection management and protocols. UTI contributes significantly to healthcare cost and resource utilization. Strategic allocation for healthcare resource toward the prevention, early detection, and effective treatment is essential to mitigate their impact. Urine RE, a simple lab investigation, which will save millions and billions of dollars if done in routine. Chronic urinary tract infection can lead to a systemic inflammation that activates various immune pathways. This may include a molecular mimicry and a Bester intivation, which can perpetuate chronic inflammatory states and contribute to develop an autoimmune condition. In poor countries, sub-Saharan African, these are UTIs are more common. There are about more than 300,000 mortalities annually. We have a slide or two forward. Future research should focus on illustrating the link between recurrent UTIs and immune-mediated disorders, exploring the innovative therapy and assessing long-term impact of infection management strategies on patient outcome. Policies that promote awareness and enhance access to diagnostic and improve healthcare resources dedicated to UTI are essential. Additionally, fostering collaboration among public health officials, researchers, clinicians can drive improvement in patient care. Implementing a public health campaign aimed at educating individuals about UTI prevention, symptoms, and treatment options can significantly reduce the incidence of associated healthcare burden of these infections and immunological conditions. Chronic conditions like myalgia, arthralgia, hyperglycemia, hypertension, and things. The stress response is also called the flight and flight response. Sympathetic nervous system activation, release of glucagon and cortisol, which can cause hyperglycemia and hypertension, which is a common problem all over the world and which is a dilemma to be treated and which is the cause of all the burden of the healthcare. So, exploring the UTIs and their role in pain and causing distress in changing homeostasis and altering the body normal response, activating sympathetic nervous system is responsible for this condition. Just by reversal of sepsis, urinary tract infection, urine culture, and ultrasonography abdomen, it will prove to be the management changing test for the patient. Chronic stress suppresses immune function, making it more susceptible to illnesses. Immune suppression increase infection risk, and chronic stresses increase the risk by about 30%. We are presenting it. It is here. It is this problem is here for policy recommendation. You can have your data in your campus, in your hospital. It is very simple. Have your data on cold drinks and cold things. Have your data on sour. And just do simple things like urinary and ultrasonography for patient. Just routine. These are non-invasive labs. You will find them that they can change the management of the patient. They can change the whole scenario. So it will be a game changing, and it is here for policy recommendation to study urine culture, and their effect on body and pain. Chronic stress can lead to serious health problems like cardiovascular disease, hypertension, heart attack, stroke, mental health, anxiety, depression, burnout, hyperglycemia, diabetes, and other complications. Hyperglycemia complicate disease management. Insulin resistance, blood sugar level can lead to insulin resistance. Cold and acids. Sour. Cold and acids were avoided, and 50 minutes daily walk were advised. Walk in interval in different time of the day. It was advised, and the effect was astonishing. We just use antibiotics according to urine culture or empirically according to urine culture again, and hydrochloroquine. Hydrochloroquine for immune modulation. Avoidance of the cold and sour. It proved to be a life-changing, just like a miracle for a pain patient. And you can try it in any country, anywhere around the globe. The neuroendocrine immune axis is stress-activated sympathetic nervous system, and which activate stress hormones and which cause insulin resistance or a catabolic surge. Catabolic surge and the anabolic process surround which causes an impaired immunity, weaken your defense system, and there will be silent infection, increase vulnerability to again infection. So there will be recurrent UTIs. Stress, economic stress, social stress, and then the stress of disease on itself will cause increased sympathetic stimulation and increase catabolic hormones and increase infection. In terms, decrease immune strength and increase immune malfunction. Immune malfunction, it can vary from any skin, upper respiratory, eye, ENT, or endocrine, or rheumatology. So and then immune system can affect anything. Diabetes, hypertension, and things which are the major killers of today. UTIs, these are particularly common in women. So they should be aware, they should be a part of the curriculum, it should be taught in schools and in colleges. They should be aware to do urine RE. These are simple tests. They should be available on the campuses. So before coming to hospital, if you do urine RE test, it can save you your healthcare a lot of money. Stress, catabolism, and immune malfunction, and repeated inflammation result in chronic comorbidities and life which is dependent on healthcare, which is causing economic drain to the family, affecting the whole family. We promise a quality of life, an active life with your loved ones without any dependence on anything taken from the market. Just need basic medication, which is evidence-based. And you can have 85% decreased visits to a hospital. Autoimmune diseases, there can be genetic factor genes which can predispose to autoimmunity, environmental factors, toxin trigger, which can trigger autoimmune response, and then there can be immune dysregulation by itself. So in developed world, there can be weather, there can be extreme cold for the immune activation and things. In our world, in developing countries, in Pakistan, where we have studies as Pakistan, Pathan population, Pakhtuns, which are called Pakhtuns, basically most of the patient were Pakhtuns, almost 90%. So we have studied that urinary tract infection were found to be the root cause of these patients presenting in orthopedic outpatient with different complaints of radiculopathy, arthritis, myalgia. Even today, I have seen more than 13 patients with the same complaints, different complaints of shoulder, knee joint, ankle, and things. And with the common thing was urinary tract infection. Some of the young guys, they were having some unhealthy diet, so they were advised just to avoid cold drinks, and they were not given any treatment, and they will be checked in a week again, and we will study this event. So there is mindfulness, there is nutrition, and there is exercise. Just walk, organic or near to organic nutrition, diet, and mindfulness. You should have gratitude for all you have. You should wish blessing to the rest, blessing and prosperity. So, a lifestyle, regular exercise, and balanced diet, meditation and deep breathing, connecting with friends, connecting with family, connecting with loved ones. Proactive steps can improve the overall well-being and resilience to stress, focusing on the present moment, cognition, challenging negative thought pattern, and professionals seeking therapy and counseling. The interplay of stress, infection, and immune dysfunction in chronic diseases. As urbanization and modern lifestyle have led to increased stress and poor nutrition, a rise in chronic health condition. Presentation explore the interconnected role of stress, urinary tract infection, and pain. And immune dysfunction. Annual health cost about 300 billions annually to the workplace. The US is to 10 billion annually in terms of disease related to depression and anxiety. The annual cost of treating UTI in US is 2 to 3 billion, with the hospital acquiring UTI adding about 340 to 450 million dollars. Non-neoplastic atraumatic pain is primarily aseptic pain is often immune-mediated condition like fibromyalgia, chronic fatigue syndrome linked to immune dysfunction. Our message is IM or IV vitamin D supplementation, vitamin B supplementation, or folic acid if needed, or patient UTI need to be treated to control the blood loss. You have to be happy. You have to be happy by doing things, walking around, socializing, even then even you can convert the catabolism to any anabolism. Cold exposure, ingestion of sour food, is a key trigger of immune activation in pain. Avoiding these allergens can significantly alter the natural history of disease. We have studies alpha-calcidone, IM vitamin D3 for weeks, addressing the deficiencies. We have studied IV's hyaluronic acid in our studies, and we have done a few urine cultures for non-traumatic aseptic pain. Immune modulation was done with hydrochloroquine, and we advise anti-gravity strengthening exercise. So over in 30,000 families visiting orthopedic OPDs, a common trigger of immune activation in pain were identified as cold exposure or sour food. Ingestion of any sour food is related to direct contact of the food of the patient with the clinic. Low-grade infections, either transmitted or self, either due to food or exposure to cold. It was still a mystery, but there was low-grade urinary tract infection on urinary. 70% of them were urine culture positive. It gives us a consistent, reproducible result in managing immune-related conditions. Just treating immune urinary and urinary tract infection and some immune modulation. Lifestyle modification like avoidance of triggers and physical therapy. Strengthening of the anti-gravity muscle and maintaining length of the gravity muscle. It is effective in breaking the cycle of immune activation and improving patient outcome. This approach is simple, efficient, and reproducible, offering a promising framework for management of immune conditions. Stress, chronic disease, infection, and immune dysfunction. It's very easy to study. CBC, ESR, urinary, ultrasonography, abdomen, pelvis, uric acid. These are simple values, can be done in any lab, anywhere in the world. It's one of the cheap ever investigation done. Additionally, there was just cold and sour prevention, nothing else. Use of gloves, use of mufflers and things, use of socks in cold weather. This was it. So, in conclusion, track and progress on your patient, track him, develop his own goals, and teach him how to treat his problem, how to do a urine RE, and then treat him according to antibiotic, or treat him or teach him about stress, that how by simple walk, adequate hydration, and socializing, sitting with loved ones can give you a feeling of joy, can overcome the daily stresses. And diagnosing the chronic musculoskeletal pain can be difficult. Imaging often reveal no structure abnormalities. Treatment mainly targets symptoms relief. The overlook potentially underlying immune issue. Diagnostic uncertainty and limited treatment options. This is a big dilemma, and there is hidden infection, and which is urinary tract infection, which can be diagnosed anywhere. Just a simple suggestion to do urine RE test and a few urine culture tests in your pain clinics or orthopedics or neurosurgery or any consultant pain clinics. Environmental trigger amplifying immune dysregulation can worsen immune dysregulations. These are pollution exposure and allergen sensitivity, brain hormone and immunity, UTI, environment, neuroendocrine response, and chronic. Address UTI manage triggers, modulate hormones. Future research is needed to validate this model. Clinical trials should assess new treatment approaches, a better understanding of this mechanism, and improve patient care. Validate the model, clinical trials, and improve care. Thank you. So nice of you. Any question?
Okay. Thank you very much, Dr. Abubakar, for your presentation. And there will be, I have few questions. I know that Ravi can see or Dr. Yamashita and Dr. Patricia can see if any questions are there in the chat. Okay. So, Dr. Abubakar, have you heard about oxidation therapy called chlorine dioxide?
Yes, I have heard about it and I have read about it. But the
Okay.
thing is where we practice and we do our things. Where I am based, it is KPK. It is, I'm not sure you have heard about it. It's a province of Pakistan near Afghanistan. So we have very limited resources over here. And
Okay.
yes, we have just a few hospital having MR and things, and just a few by name. You can name the physiotherapists over here who are available to work here. So we have very limited options. And the thing was, I started practicing and I was answerable to the people. I was managing the people. These were from my village and my people. So what we done is we done CBC and ESR for them when they arrive, whenever they come. And we have found that the finding that every time they came with a pain to my clinic, they were having some urinary tract infection. So they were carrying different prescriptions from renowned doctors of osteoarthritis and radiculopathies and spinal decompression advice and things. And we give them simple antibiotics empirically on the culture list available or did some cultures for them. Interestingly, their pain improved. They improved a great deal. Then we started.
That I understand when when you don't a particular country doesn't have the availability of a particular substance, you will have to
Yes.
depend on antibiotics or other things. But it is
Yes.
in our DFW that most of us we have really hands-on worked with the chlorine dioxide as one of the detox method. And we have seen that we have eliminated the antibiotics completely, zero antibiotics, zero steroids. Most of the, even when we are using DMSO, we are not using even a painkiller. And we have stopped talking about diseases, chronic diseases as connected to genetics. Because I say that there is no disease will pass on from one generation to another generation if the detox is done properly. It is the environment on which the genetics actually responds.
True, it is the environment.
Yeah, so it is the diabetes, the hypertension, the thyroid, just name it, the autoimmune disorders, they can just be fantastically responding to the combination. So I always call it the 7 detox system we have in our cells. And if you support with all, that is why it is more integrative. So no, it will be really fantastic if Dr. Abubakar can actually do something like in my country, I do it as a water purification solution because we cannot do it as medicine. But I use it very boldly as advanced detoxifier. So that is one of the very important line of treatment as humanity we can get now. Yeah, thank you so much. Anything, Dr. Patricia, to say about?
Yes. Sorry, here there is a question from Francinetti Gifoni, de São Paulo, Brazil. Do sleep and GH hormone have any influence?
What? Again, please.
Yes, sorry. do sleep and the GH hormone has any influence?
Growing
Yes,
hormone.
yes. Hormones, they have very or they have their own rhythm. They have their own timings. They have their own circadian rhythm. So it needs a proper time for sleep and then a proper time to get up. Your hormones will be normal if you have early rise before sunrise. If you get up, so this is the ideal time to rise and early to bed. So these are early times, and and then you can achieve a homeostasis, a balance in your hormones and your system. Otherwise, altering this sympathetic and parasympathetic system, switching on sympathetic for longer duration of time, alter this glucose balance and your blood pressure regulation. This cortisol and glucagon, we call it stress. Stress, injury, insult, disease, we call it the same thing. But stress, injury, insult, disease, these are all the same thing causing decreased glucagon or insulin resistance. You have to address. It is a social, mental, and physical well-being and not absence of a disease. So what we do, we advise to anyone around the globe, just walk. Have a good pair of shoes and walk. Have warm water. This is medicine. Avoid cold air, cold water. Don't take anything sour. Titrate it. And this is life changing. This is the game changer. You can see the results in days. Beautiful results just in days. Miracle. It is just quick than you can imagine.
Dr. Abubakr, there is another question from my colleague from Brazil, Francinette Gifone, is asking, what do you think about ozone therapy? Do you know it?
We know about a lot of things, ozone therapy and things. But the things is the place where I am working and the things which can be done anywhere like urinary, which can be done anywhere on the mountains, in a rural area in Africa, or even a John Hopkins. You cannot avoid a urinary. So my point is the validation and the importance of a urinary, that it will remain important around the globe each and every time. Even if you miss it now and misdiagnose a patient, you cannot negate it. So my point is just please to stress the importance of simple urine examination and ultrasonography, abdomen, pelvis for kidney ureter bladder in patient coming to hospital. There are lots and lots of reversible causes like stones, prostate, strictures and things which can be resolved there and then, and there is the end of the whole problem. So things is baseline investigation, patient education, and lifestyle modification. Minimum medicine, which can prevent diabetes, it can prevent hypertension. We have treated the cases of a patient reported with or taking medicine of hypertension and diabetes, and now they are not taking any medicine. They were treated for a month or 2 months for pain, and now they are not taking any pain medication even. They have just an active lifestyle and avoidance of allergens. So this is a beauty. And if I'm saying it, you can reproduce the same result in India, in Brazil, in anywhere in the world. And uh, there was one patient from Mexico, I guess this was from the friend here. He referred it somehow. And he was very happy after that. And we have advised him the same treatment. So this is a simple treatment which can be reproducible. You can do it in Brazil, and your patient will be happy. Just avoidance of cold and sour.
Thank you, Dr. Abubakr. There is another question here.
Yes.
Congratulations, Professor. I don't know where this people is from. He is asking, which biomarkers do you think it's useful to identify chronic inflammation? And I would like also to ask about silent urinary tract infections, challenge. How can you diagnose them?
The marker that we studied was ESR. Sometimes CRP was done, but mostly we have done ESR. Most of the cases ESR was done. This was an old lab and still the same. It was done in Kalanai in 3 stations, in Peshawar, in Mardan, in Sawabi. So it was done in different stations and ESR was done. CRP was done occasionally in a few. And urinary tract infection, regarding that, we have done urine analysis of any patient coming to orthopedic OPD, whether there were any complaint or no. 80% of the patient were having no active urinary tract complaint. Some even argued about the validation of a urine RE, but when done, proved to be infection and treated with antibiotics. They were assured that this was something, pain in the sacroiliac or pain in the lumbar spine or pain cervical spine, which is basically reactive activation due to some urinary tract. I have seen about 14 patients today. In 3 patients, there was median low projection into the bladder. It was more than 70 years old. In 2 patients, there was renal stones. In 2 patients were young, and they had both partners having pains and necks and fast foods and things. So today, I have collected a sample of 14 patients. These are available in my charts around here in Pakistan in my area.
Dr. Susan? Okay. Mhm. Dr. Susan said, there is only one disease called toxin and only one remedy called detox. There are only 3 types of toxins: molecular toxins, pathogenic toxins, parasitic toxins. Okay. A question from Raul. Would you classify as UTI in the general tract urinary test by the number of leukocytes, proteinuria, nitrates, RBC only?
We do urine culture if needed, but in presence of arthralgia in male patient, more than 4 WBCs or more than 4 pus cells or any RBC in red blood cell in male urine were taken as infection. Sometimes they were further sent for urine cultures and confirmed. In female, premenopausal and premenarche and postmenopausal, it was just 4 to 6 pus cells was normal with no RBC in their urine as well. In reproductive age, there was the same amount of pus cells, was 1 to 2 RBC that was given privilege to that the lady in the reproductive age, and they were tested only in the mid-luteal phase. Urine culture was additionally done when required. And we have a data of our urine cultures in different areas. Like we have a urine culture data for our Mamand agency, for Mardan, for Khyber Pakhtunkhwa, for Peshawar, and we apply it if needed. If somebody is not able to done a urine culture or wait for urine culture, we do an empirical selection from that list for that person.
Okay, thank you, Dr. Abu Bakri.
Thank you. Thank you. So nice of you.
I have one more question.
Yes.
Dr. Abu Bakri, do you think that the microbiome from the gut, the intestines, they can
Yes.
also interfere?
Yes. 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 This is the whole concept of microbiome. This is the whole concept is like this. This is what you can reverse. What is treated is what you do to a human. And playing with vitals, you can do reverse the volume, intravascular volume. You can do fluid. You can go for blood. Okay, and you can reverse sepsis. If there is sepsis, and urosepsis is very common. Urosepsis, it is very common. The collecting system of the urinary tract, renal pelvis, ureter, bladder, its mucosa, and the ureter, it's scanty. There is a scanty blood flow, just a scanty blood flow. There is no blood flow almost over there. So, if the blood flow is diverted anywhere and it is reduced to that place where there is no blood flow and there is colonization, there is going to be pathogenesis. You can just help the body if some part is crying of pain. Just help him with something which is Euroculture sensitive. And we have proved it to be effective in hundreds and thousands of times.
Okay. Any question else?
Uh, sorry. There is a Francinette from Brazil says that they are not audio. Something happens. They are not listening. Sorry.
Yeah,
Well,
that's something that sometimes happen, Dr. Patricia. Regarding the cadence, we have only one interpreter for Portuguese, so that might be the reason why they are not listening, because uh, we have only one interpreter for Portuguese.
Okay.
there is one other question. Mr. Ernesto Castellanos, he's sending a question. Please,
Yes.
what are the symptoms, most common symptoms of urinary tract infection that a person without medical knowledge can identify, and how can she perceive that is having some problem there?
Urinary tract infections are mostly asymptomatic. The whole thing is that urinary tract infections are mostly asymptomatic. Kidneys being a vital organ responsible for the production of erythropoietin, formation of vitamin D, blood pressure regulation, blood volume regulation, can have any silent infection. And the thing by which you can diagnose is a simple urine RE. So if you are not even feeling good for any good reason or any no reason, just go for a urine RE test. You can add an ultrasonography abdomen pelvis for kidney, ureter, and bladder. Both are non-invasive. Both are cheap and both are easily available. You can screen out the organ in danger, which is lower line, the line, and which is white. So urinary tract infection, it should be tested first in case of any disease. And sepsis there should be reversed first. Thank you.
Okay, so we if we have no more questions, now we are going to.
Yeah.
Well,
Dr. Abubkar, I was really surprised to find in your documents of previous conference the importance of cold exposure for our
Yes,
macrophages in terms of activating the immune system in a
yes,
way so violent as you described that they turn into autoimmune diseases, and that's something
yes,
that is not widely spread among the literature, medical literature, and they do not have this sense of feeling of the importance of sour foods as well as of cold temperature, and altogether with UTI subclinical
yes, yes,
manifestations.
yes. That's why I'm here. That's why I'm here, panel. That's why I'm here to present it. That's why I have written it. That's why I'm on LinkedIn for 4 years. That's why I'm on ResearchGate for 4 5 years. Just for this cold, sour, and UTIs. The efficacy of simple walk, a good pair of shoes, warm fluids, keep yourself warm, avoiding of the cold air and cold water and things, and avoidance of salt. Titration of the sour food. Titration is something we have learned around the globe. You have learned it in Mexico, somebody in Chile, somebody in Brazil. What is titration? Why titration was learned even in class 10? Everybody learned titration in school. You have learned titration. So what was the reason behind it? The reason behind this was very simple, that you have to titrate sour foods. That's why juices are there. That's why fruit charts are there. You have to titrate it to get the nutrient, which is good, which feels good, and which will have a good impact on your health. So titration, it was advised here, and sour food, it is being told the rest of the world or the whole world. There was a patient, one from Mexico. I think you have referred him or something. That he was a diabetic and hypertensive man with some knee and lumbar spine problem, and we have advised him some alpha calcidol and then same cefixime and hydrochloroquine. He was very happy after that. I have never seen him after that, but he was very happy. After a week and 2 weeks and 3 weeks, he was very happy. And we have some very good results, some beautiful results over the period of time. This thing was formulated in about 8 years. It was not like this. It was formulated from 2008 to 2017. And then it is in practice in 2017 as such, then it is written in 2020 and 2021 for the first time. And I have presented it to have your data in your country. I will not be there. Just go for your urinary check and in case of pain and things. So this is very simple. This is available on ResearchGate. This is available on LinkedIn. I am known for this cold, sour, and UTIs. And if you can do it, you can have some astonishing results.
May you say that you would find low energy in these subclinical UTIs, Dr. Babukar, or arthralgia,
Yes,
joint
arthralgia,
pain?
low energy, unable to get up from the bed early in the morning and not willing to work, and even chronic anemias. Chronic anemia of old age are the result of blood loss in urinary tract. 1 to 2 RBC per slide means about a million RBC per day. This is 40 microliter in a slide. If you're doing it 1 to 1.5 liter, so 1 to 2 RBC per slide means a million of RBC per day. But it's too much. It is the cause of blood loss. It is the cause of iron deficiency. So there is a continuous loss. You cannot overcome it by folic or iron supplementation. You have to prevent the loss. Treating infections. Okay, and stress is the topmost cause of UTIs. So stress was found to be only effectively dealt by active, just simple walk. No other measure or drug was there to counter stress as such. There was a lot of factors like social, economical, and things. So walk was found along with warm beverages, warm water and tea and things. They were found to be effective in coping up with stress and things. So this is avoidance of cold and sour, warm fluids, and treatment of urinary tract infection, along with use of immune modulation. No use of steroids. No use of steroids.
Dr. Abu Bakr, let me share my experience when I visited China. I went to Tibetan hospital, and
Yes.
they showed us their method of analyzing our urine. They
Yes.
could see our urine without microscope, and
Yes.
through visualizing its characteristics, its color,
Yes. Yes.
density, they could
Yes.
say about the health of the person, and
Yes.
we were very impressed because
Yes.
they could say the real health condition of the
Yes.
person.
Yes.
Yes,
Yes. This is
do you use also this method?
yes.
Oh, very good.
Urine analysis. It is very simple and the most informative lab which is underrated around the globe now due to modern practices, due to MRIs and CTs, and we are rushing in ordering fancy labs and things for patients. We just forget a simple urinary. Just never forget there is a history, there is a clinical examination, then there is baseline labs, CBC, ESR, urinary, ultrasonography, abdomen, pelvis. If you start from there, you will have the correct diagnosis. You can have your diagnosis back there. And if it is UTI and there is pain, use immune modulation and use a good urine culture sensitive antibiotic. That's all. That will be the end of pain. There will be no dilemma of chronic pain. We have been treating them successfully. Patients are being happy. Debilitated patients are being happy. We were able to mobilize bedridden patients, and we were able to get rid of hypoglycemic and hypertensive patients in many patients. They were worried about their aches and pains and their health, and they were not able to get up and move around. So when this problem are solved, they are normotensive, they have no blood pressure, they have no sugar issue, and they are economically active. And that's a big, big win. Anyway.
Well, Dr. Abu Bakr, I would like to thank you for so rich informations, and we see that many diseases are caused by chronic inflammation that may come from urinary tract infections, as you said, from the dental process, and from the gut, from the stress, a stressful life, an environment with many toxins that we are living today.
Yes. Today, urbanization and today world, it is a source of stress. This is a big this is the need of the hour to talk about stress and its repercussions causing UTIs and things.
And talking
I
about
would also add that we as human beings added toxins from so many medications and vaccinations too.
Yes, I agree 100%.
But
yes.
Talking about toxin, doctor, would you have found any kind of relationship regarding, microplastics, nanoplastics, or even heavy metals as a source of, metabolic disruptions, hormonal disruptions, and UTIs prevalence?
It is not in my observation, but
Okay.
it is in my knowledge that
Okay.
I have read about it, but we have not, there is nothing to be clinically observed it in our practice.
Right.
Yes, but there is different definitive literature on internet, which there is a role of nanoplastic in these immune diseases and things.
Yeah. Thank you.
Okay, so
Thank you.
today it was a very special session for many reasons. The first one for your presence, the second of one of for our special guest, and finally for so many new interpreters joining DFW. So we have the help of interpreters from English to Portuguese, Stella and Santos, Brazil. Doris, also from Brazil. English to Spanish, Shifra Lipson from USA, and Mario Angarita from Venezuela. Uh, English Italian, we had the help of Alejandra Munoz from Mexico and Eleonora Pepe, Italy. And English to French, no, this we didn't have today. And English Arabic, Mohammed Tayel, Jordan. And our additional thanks to Donaji Rodriguez, nutritionist Maria Fernanda Iturbe from Mexico, Dr. Frida Rosas from Mexico, Vivian Freitas, Paraguay, and Patricia Guia from Peru for their immense daily help to our organization. They represent a new generation of professionals committed since a very young age to their communities and the world's population. Special thanks to IT specialist David Garcia, colleague of Sciences and Humanities Vallejo, who edited the DFW opening countdown and organizational video. Additionally, to Norberta Rincon, who supported us with the registration to Vimeo platform. They are a source of pride for us. And thank you, Dr. Abu Bakr and Dr. Susan Haj, Patricia Calesperis, Raul Pineda. This is Dr. Ricardo Yamacita from Brazil. Any final comments would you like to address, Patricia?
I just want to say thank you. Thank you very much for the approach. I think it's very important. Those are things that we sometimes we don't think about, but so it's very important, the environment and ourselves. Thank you very much.
I would like to close with our organizational video. Let me know if you can hear it.
Thank you once again.
Yes.
Can you listen to it? Yes.
Yes.
Yes. Yes, perfect.
Yes.
So thank you again for being with us today. And thank you, Dr. Abubkar, Dr. Yamashita, Dr. Susan Raj, Dr. Patrick Calisperis, Eleonora, thank you. Shifra Lipson, so thank you so much. Selene, thank you. And Mario, thank you indeed. So have a blessing day, a nice weekend, and let's see if next week we can do it again with Janine Galizia from Australia. So bye for now. Thank you indeed, and bye bye for now.
Bye bye.
Hasta pronto.